This video is about the use of fluoroscopy or fluoroscopic guidance when performing Coccyx injections or tailbone injections. I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States. My website online is www.tailbonedoctor.com. And in this short video, we're just going to talk a little bit about the benefits of using fluoroscopic guidance when doing or having Coccyx x-rays in the treatment of Coccyx pain or tailbone pain. So behind me here is the fluoroscopy machine as shown here and with the screens up there. And fluoroscopy is similar in some ways to x-ray that can be displayed up on a computer screen, except it's done in very tiny increments, so a fraction of a second often of image that's obtained, so that when a patient is having a injection for Coccyx pain, the very first thing, more important than the injection itself, is that the physician actually does his or her best to make an accurate diagnosis. So I see this all the time in patients who fly in to see me from around the country, where they've had multiple injections done for tailbone pain, but nobody has actually made a diagnosis as to what's causing their tailbone pain. And that's a problem because if you don't have a specific diagnosis, it can be more difficult for the physician to know where is the target location at or around the tailbone where the injection should be done. But assuming that you've gone through the appropriate steps to have a specific diagnosis made, which typically includes having Coccyx x-rays done while you are sitting and comparing those with the position of the coccyx or tailbone while you are standing. So let's assume that you've had those sitting and standing x-rays done and they showed a dislocating segment between coccyx bone number 3 and coccyx bone number 4. Well, then you would want for the injection to target that specific joint or that specific bone or that specific location where the abnormality was found. So often what I see, unfortunately, is that physicians will either do the injection blind, meaning they're not using fluoroscopic guidance, they're just sticking the needle somewhere in the area of the coccyx and injecting steroid or lidocaine or other local anesthetic, and they're hoping for the best. And sometimes that may actually give some benefit for some patients, but it is far from ideal. Ideally, you want to have a specific diagnosis when possible, which it is in the majority of patients, and then you want to target the injection to the specific site of abnormality. And using the fluoroscopic machine, the fluoroscopy machine, we can target the specific joint or bone, or abnormality. So basically, just to show you a little bit of how this works, this is the fluoroscopy machine, right here, and the monitors, up here behind me, and then on the table here, I have a plastic model of a pelvis, which you can see, the coccyx is right, right down here at the lower part of the spine. And in this position, when I take the fluoroscopic image, as shown here, again, I'm hoping this will show up okay on the screen. But basically, you can see the details, here of the coccyx. In this case, it's a plastic model of a coccyx, but really just showing enough to see that there's individual bony segments throughout here, and there's individual joint spaces between those bony segments, and here's the lower tip down here. So for many patients, we'll have a bone spur down on the lower tip of the tailbone, and again, that needs to be made as a diagnosis from the patient's x-rays or MRI or CT scan, or sometimes you can detect that even on physical examination. But then you want to have your injection be specific to what the patient's abnormality is. So again, you can see how by seeing the details up here, then as the physician treating the patient, when I'm doing the injection, it's a very small injection. It's not a very deep injection at all because the coccyx or tailbone is very close to the skin. I can make sure that I place the needle specifically at the joint or bone or abnormality in question, so that I can be confident that I've gotten good coverage at that area. It's unfortunate for many patients that have injections done by physicians that are not as familiar with treating the tailbone, and again, either they do the injection blind, or even if they're using fluoroscopy, because they have not identified the abnormality, they're using the fluoroscopy to inject someplace on the coccyx, but often it's not the place where the person actually has their abnormality or actually needs the injection. So again, this just kind of shows you the general setup for an injection. The patient comes in. We would of course have a fresh sheet and all of that on the table. We basically position them like this. We get the image nicely up on the computer screen, as shown on the two screens here, and do the injection in that way. So that's just a little bit about fluoroscopic guidance when it comes to performing coccyx injections. If you're interested in more information about coccyx pain, you can go to my website, which is tailbonedoctor.com, or if you have tailbone pain and you're interested in getting a copy of my book, Tailbone Pain Relief Now. The book you can get either at the website tailbonebook.com, or you can go to Amazon and just search for Tailbone Pain Relief Now, or if you search for my tailbone and my last name, which is Foye, F-O-Y-E, that'll come up in the Amazon search. Or if you're interested in coming to see me for evaluation and treatment for tailbone pain, the easiest way to find me is to go to my website, which again is tailbonedoctor.com. So I hope that's helpful information for you about the importance and benefits of using fluoroscopic guidance for injections for tailbone pain. Okay, bye-bye.